Hi everyone, today me and my groupmates are going to talk about STD. So STD is sexual transmitted diseases. So these are infections that spread through sexual contact. Some people don't notice symptoms at first, but if not treated, STD can cause serious health problems. So in this video, we will explain what STD are, how they spread, their symptoms, and how to prevent them. So if you want to know more about STD, keep watching until the end. So in our objectives, at the end of the discussion, the student will be able to define STD, identifying the different types of STD, and determine its symptoms, diagnosis, and treatment. Sexual transmitted disease. So STD is an infection through transmission with a person who is infected with the disease through intimate contact with another person. Because if a person has this disease and they have sex with someone else, they can pass it to them. The second is STD has been the most common communicable disease in the United States and other developing countries because they don't use protection or don't know they are infected. And last is STD is related to prostitution because people who sell sex or have many partners are more likely to get and spread this disease. This picture shows how some disease like HIV can spread from one person to another. And the first one is sex without protection. Because if two people have sex without using protection, they can pass disease to each other. And the next is sharing needles. Because if someone uses a needle and another person uses the same one, disease can enter their body. And the next is blood contact. Because if infected blood touches an open wound or goes into another person's body, the disease can spread. And the last is mother to baby. Because if a mother has a disease, she can pass it to her baby during pregnancy or birth. So it's important to be careful and protect ourselves to stay healthy.
So these are the types of STD. First is syphilis. So syphilis is an infectious disease caused by Treponema pallidum. Treponema pallidum is a bacteria formerly known as Spirochaeta pallida. It's a microaerophilic gram-negative Spirochaeta bacterium with subspecies that cause the disease syphilis and transmitted by sexual contact, and also if the mother is infected, it will transfer to the fetus during pregnancy. Second one is gonorrhea. So gonorrhea is an inflammation of the urethra caused by Gonococcus bacterium. Gonorrhea is a sexually transmitted infection, also called a sexually transmitted disease, caused by bacteria. Sexually transmitted disease are infections spread mainly by contact with genital or bodily fluids, also called STDs, STIs, or venereal disease. Sexually transmitted infections are caused by bacteria, viruses, or parasites, and also if the mother is infected during childbirth, the baby will be infected too. Commonly affects the eyes.
Number 3. Chlamydia is a common sexually transmitted infection caused by a bacterium found in vaginal secretions and semen. So number 4. Human papillomavirus or HPV is a viral infection spread through skin-to-skin contact, most commonly during vaginal or anal sex but also through oral sex.
So let's proceed to the next type of STD, the genital herpes. Genital herpes is a very common STD that anyone who is sexually active can get. Most people don't even know they have it because they don't show symptoms. But even if there are no signs like sores or blisters, it can still be passed to a partner through skin-to-skin contact. There's no cure, but there are treatments to manage outbreaks and reduce the chances of spreading it. Additionally, you can have herpes without knowing it, and it can still be spread. Next is the human immunodeficiency virus, also known as HIV. We already know the HIV disease, it's just a common word to us when you hear it. HIV is the virus that causes AIDS, which weakens the immune system, and makes it harder for the body to fight infections. It spread through blood, semen, vaginal fluids, and breast milk, mostly during unprotected sex, sharing needles, or from mother to baby during childbirth or breastfeeding. HIV doesn't have a cure, but with the right treatment, people can live long and healthy lives. Using protection like condoms and getting tested regularly can help prevent it. But mostly, Her says that using condoms during sexual is not accurately 100% sure protection. So here we have the HIV transmission. Again, what is HIV? HIV, it is a virus that attacks the immune system, which is our body's defense against diseases. So next, what happens when someone has HIV? If HIV is not treated, it can lead to AIDS or acquired immune deficiency syndrome. This means the immune system becomes very weak, making the person vulnerable to infections like pneumonia and even certain types of cancer. Next is, how does HIV spread? HIV is not spread through casual contacts, hugging, or sharing food. It spreads when someone fluids from an affected person enter another person's body, like the blood. Blood is through sharing needles, and the semen is through unprotected sex. It is important to practice safe behavior such as using protection and not sharing needles to prevent transmission.
Who are the people discovered the HIV? It was Luc Montagnier and Francois Barry Sinoisi. Type 1. Human immunodefensive virus. Predominant strain and has the ability to mutate rapidly. Global HIV epidemic comes from chimpanzee. Human immunodefensive virus types 2, less prevalent and less pathogenic, comes from Western Africa. There are 3 types of sexual activity. First, homosexual. Second, heterosexual. And lastly, bisexual.
Now we're going to talk about how HIV transmitted in misconception. A lot of misconceptions are being popular nowadays. And there are 3 symptoms. First, mosquito bite. Second, using of the toilet. And lastly, socializing with others. The truth of this, we can get the HIV disease. But the truth is, HIV is being transmitted through shaking hands, kissing and hugging someone with HIV, bathing in a swimming pool, using the equipment to someone with HIV, and using manicure sets such as nail cutters, pushers, and nippers.
Signs and symptoms of HIV. How can you tell if you have HIV? You can't rely on symptoms to tell if you have HIV. The only way to know for sure is to get tested. Here are some symptoms of HIV. You will feel muscle ache, chills, mouth ulcer, fever, sore throat, fatigue, night sweat, swollen lymph nodes, and skin rashes. Opportunistic infection have fungus. So the number 1 is pneumonia. Pneumonia means caused by a fungus that normally exists in the area of all people. And when we say fungus, means that is any member of the group that of eukaryotic that involves a microorganism such as yeast and molds, as well as the more familiar mushrooms. And the number 2 is thrush, an infection of the mouth caused by Candida albicans. Candida albicans is an opportunistic pathogenic yeast that is common member of the human gut's flora. Number 3 is meningitis, means caused by Cryptococcus. Cryptococcus means that is an genus of fungi in the family Cryptococcosae that includes both yeast and filamentos. Mycobacteria avium is a bacteria that can cause fever, weight loss, anemia, and diarrhea. And we also have here protozoal parasites. It's a toxoplasmosis of the nervous system. Toxoplasmosis is a parasite disease caused by Toxoplasma gondii and Apectromyxan. 7 is trichomoniasis, called Trich for short, is an STD that's cured with antibiotics. It's super common and most people with Trich don't have any symptoms.
Symptoms of STD. Symptoms of STD. There are different symptoms for men and women. First, for the men. Appear within 2 to 3 days or few weeks or even months after having sex with an infected partner. These are the common 6 symptoms of STD. Number 1. Pus or discharge from the penis. 2. Burning sensation, pain when urinating. 3. Painful sore blister around the penis. 4. Lumps and lumps on near the penis. 5. Itchiness in the penis, structal on public area. 6. Structal swelling. And for the woman, these are the common symptoms. Burning sensation or pain when urinating. Second, painful or painless sore blister around the vagina. But STD in women are often silent or mild and usually unnoticed.
Sexually transmitted diseases, or STDs, can sometimes go unnoticed, making early diagnosis essential. So how do doctors confirm these infections? Let's break it down. If a person has had unprotected sex or is experiencing symptoms, medical tests can help detect an STD and any possible co-infections. There are 3 main ways doctors diagnose STDs. First is blood test. Blood tests are used to confirm infections like HIV and syphilis, especially in later stages. Second, urine samples can help identify certain STIs with a simple lab test. And third, fluid samples are taken if a person has genital sores or abnormal discharge, helping to determine the type of infection. Early detection is key because some STDs, especially in women, may have mild or no symptoms. That's why regular testing is important. If you think you may be at risk, seeking medical attention as soon as possible can make all the difference.
Next, treatment of STD. Treatment usually consists of one of the following depending on the infections. So, there are 2 main categories of treatment: antibiotics and antiviral drugs. Antibiotics, often in a single dose, can cure many sexual transmitted bacterial and parasitic infections, including gonorrhea, syphilis, chlamydia, and trichomoniasis. Typically, you will be treated for gonorrhea and chlamydia at the same time because the 2 infections often appear together. So, antibiotics are medicine that kill bacteria and parasites that cause certain. They work really well for infections like gonorrhea, syphilis, chlamydia, and trichomoniasis. Sometimes, just 1 dose of antibiotics is enough to cure those infections. Doctors often treat gonorrhea and chlamydia at the same time because they usually happen together. It's very important to take all the medicine exactly as the doctor tells you. Even if you start feeling better before you're done, just make sure the infection is completely gone and doesn't come back or become harder to treat. So next, we have antiviral drugs. Antiviral drugs favor hair recurrences. If you take daily repressive therapy with prescription antiviral drug lessen the risk of infection, but it is still possible to give your partner herpes. Antiviral drugs can keep HIV, an infection in check for many years, but the virus persists and can still be transmitted to the rest is lower. Antiviral drugs as medicine that help control certain viral infection like herpes and HIV. So for herpes, if you take antiviral medicine every day, it helps reduce how often you have symptoms or outbreaks. It also lowers the chance of spreading herpes to someone else, but there's still a risk of passing it on even their treatment. So for HIV, antiviral drugs help keep the virus under control for many years. They lower the risk of spreading the virus to others, but the virus can still pass on. The main point is antiviral drugs help manage the infections and reduce the risk of spreading them, but they don't completely cure the infections.